As more frontline workers are receiving vaccinations, we're learning more about their stories and their experiences. And this one is actually a family affair. We want to welcome a mom and son duo. Rhonda Browning is an emergency department trauma nurse at Penn Presbyterian Medical Center in Philadelphia, and that's her son, Dustin Flannery. He's a neonatologist who practices at Pennsylvania Hospital. Mom and son, thanks for being here.
Thank you.
Thanks for having us.
So you guys have not seen each other than drive-bys for a while, and you spent a majority of this pandemic apart, right? But Friday, you did something that will eventually bring you closer together soon, right? You both got your first dose of the COVID-19 vaccine. So first of all, what made you decide to go ahead and get the vaccine?
Well, I knew that I wanted this to end quick, and I wanted to be able to see my family and my friends, and especially be able to take care of my patients safely.
Any hesitation, Dustin, or you went right for it?
No hesitation at all. When I think about the vaccine, I think I'm not just getting it for myself, but I'm getting it for my grandmothers. I'm getting it for our neighbors. I'm getting it for my nephew's classmate who's immunocompromised. And what better time to give back to your community than at Christmas?
So Rhonda, first up, what was your experience like getting the vaccine, and how are you feeling?
Honestly, it was like probably one of the most exciting things I've done in a year. I know that kind of sounds silly and people thought I was crazy, but we could not wait for this to happen.
It was the first time in the hospital that things felt upbeat. There was an excitement, there was an energy, there was a happiness. And I think for the first time since February, there was just a sense of hope.
So what do you have to say to anyone who may still be nervous about getting the vaccine? Any advice, thoughts on that?
Everything we do in healthcare has risks and benefits. When you take a medication, when you get a procedure, everything has risks and benefits. We know how dangerous this virus is. We know the risks associated with this virus. We know how many people are being hospitalized and dying every day across this country. And we know that the benefits that the vaccine can bring. Vaccines can have risks as well, but we know from the safety profile of the study so far that those risks are quite low. And so I think for myself and for most people, the benefits outweigh the risks.
Ron and Dustin, thanks so much for sharing your stories with us. We appreciate it.
Thank you so much. Love you guys.
Thank you so much. Take care.